I tell my patients that my main goal is to relieve stress and anxiety. And being available to the patient eliminates so much stress because so many times they don't know who to call. They don't know what they're really asking sometimes. And so that's where the navigator is really important.
That's Karen Waldrop from UAB Medicine. You'll hear more from her up next. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Hepatocellular carcinoma, or HCC, can be curable when detected and treated early, but disparities in awareness and access are a barrier to early detection. Today, we hear from a patient diagnosed with HCC and the nurse navigator who helped him through his treatment journey. First, we'll hear from Henry Rendon, who was diagnosed almost 2 years ago. He's here to share his treatment experience.
When I went to the hospital and I got sick and I was in there for a few days and they ran a bunch of tests. And when the doctor came back in there, she had to tell me, that I had hepatocellular carcinoma. And she was very kind, very professional about how she worded that to me. So they said, we have some options. And I said, oh, great, I'm open to anything, even if it's experimental, anything that I can do to extend my life. And she says, well, we have this treatment, this infusion therapy. And she explained to me how it worked. And when I went in for my first session, that was the one where they put the one-time medicine only in. And I didn't have any side effects, none whatsoever. It made me feel just like little tired for maybe about an hour. And then after that, the next day I went to work and it kind of made me feel good. I felt like something good was happening. My body just started responding and I started to feel like it energized me. Like I could feel like something was working inside of my system to make me like it was fighting, you know. So the only side effects that I had is, and I didn't realize it at first, is I would get sick about 7 days later. And I'd get sick with the hot and cold chills, and I would sweat. I would lose anywhere from 5 to 7 pounds of water weight, but after I'd make it through that 24 hours, I would be back to normal, and I just went right back to work. As far as I could say is the side effects is worth it. It's very well worth the one day that it has me down out of a month, and it holding this cancer down or shrinking the numbers is well worth that experience. So I look forward to having these treatments every time because I feel like it's extended my life.
Did you feel like your treatment was thoroughly explained to you?
I was lost at first, but then I started picking up on what they were telling me. I started listening a little better. And when they'd ask me if I wanted a printout of what was going on, when I read it, it straightened everything out and it made me feel like I didn't feel lost anymore. Because unfortunately, I was single and I didn't have a co-partner to help me, like proofread, make sure I'm understanding it. So I had to do it myself a couple of times on my own. Then I got good at it. So I felt like the information that they shared with me, the way that they would explain all that stuff to me, it was exciting to hear the news that I was hearing from them. And so it was like very positive. And when they would come in there and talk to me, they would look at me like I was some kind of a miracle child or something, like a prodigy or something, because they were really impressed on how the medicine was working in my body, you know. And so they did a real good job of explaining that, and then also let me know that that was not the only option. We would continue doing this for as long as it works, but if it stops working, that there's other things that we could do, which gave me hope. You know, they told me to go ahead and live my life. At first I thought, when I first started these treatments, I'm thinking, I got to hurry up and get my goodbyes, tell everybody, everything that I think I need to tell them before it's too late. And then as time keeps going on, they told me to go ahead and live my life. So I started doing that. And, now I'm in a relationship with somebody. I'm going to buy a house. Everything's looking just super positive.
What was your experience working with the cancer team?
Yeah, whatever training y'all are giving these people, they take it to heart. They treat you as if you're one of their family members, and they want to see that you just get the best of everything that they have to offer. The only other thing I wanted to add before I forget, for me, working helped me get through it because there was so much work to do and I was so needed that I didn't have time to think about being sick and get depressed about it. They say when you have arthritis, the best thing you can do is be more active. Well, maybe the best thing that you can do when you have cancer is to be more active. That's what I found to be helpful to me.
We'll be talking with Karen in a minute. How did she impact your treatment?
She was aware of everything that I was going through and all my medications, so she would make sure that everything was coordinated and went smoothly. Excellent communicator, which I think was what got it all done. I even had her cell phone number if I needed to reach out to her. I never did have to call her like that, but every time that I talked to her, it was always in the same manner. So every time that we would have engaged in some involvement with this treatment, she was upfront with all the information, and if I had any questions about it, she wanted to make sure I understood and would answer them thoroughly. And she just left me feeling like I was prepared for what was coming. But she did that every time that we had a conversation. It was not one single incident. It was like all the way through, she was at 100% at what she was doing, like she's highly experienced in dealing with what she does because of the way that I could just feel it through her language and the way that she responds to my questions and the way that she informs me that she doesn't leave very much room for doubt.
You heard from Karen Waldrop at the start of the show. She's a GI oncology nurse navigator at O'Neal Comprehensive Cancer Center at UAB.
At our institution, we have a clinic, a liver tumor clinic, that the patient is able to see a medical oncologist, a liver medical physician, interventional radiology specialist, pharmacist, the whole gamut. If they need social work, we'll pull in social work. If they need palliative care, we'll pull in palliative care. You know, the navigation team is available, and that's in one visit. So one-stop shop. And for folks with transportation issues or that live a distance away, it's truly the best way for them to get care because they're seeing all these providers in one visit rather than having to come 3 or 4 times in a month. And for us, there's just not a better way to provide that comprehensive care for these complicated patients.
What are some of the challenges that your patients face?
We have a large Hispanic population here as well as Asian. So we deal with language barrier quite a bit. Our biggest barrier is transportation, either lack of vehicle or lack of resources to purchase gas to get to our facility. Our treatment area, our patient population is from 6 to 8 hours out from us. So we have to sometimes get creative with ways to get them to us, bus tickets or checking in with community resources. Sometimes we can partner with a church in the community to help provide transportation as well. It's kind of a grassroots network.
What kind of financial barriers are these patients facing?
Many of them are not insured, or they are underinsured, or they have, if they're of Social Security age, they have purchased managed care plans, Advantage plans, that our institution is out of network. So we frequently will have to educate patients about their insurance or their lack of insurance and refer them to their insurance company. And I always recommend to patients that have private insurance to have a case manager at the insurance company. Hopefully they have an oncology specific one, but if not, just a case manager so that they're speaking to one person with each call instead of getting a myriad of people that have to review the notes to know the patient. It's the same concept as having a navigator. You've got one patient that you develop a relationship with. Sometimes I still, if they're going to have a high out of pocket, just due to financial toxicity, I often will redirect them and ask them to find the practice or the physician that's in network for their insurance company and go there.
How does the role of the nurse navigator improve patient care?
At my institution, our navigators have phone numbers that come directly to us. They do not go through a phone tree. And we provide our phone numbers to our patients. So when they need to talk to somebody, they call us and they get us. They don't have the frustration of trying to listen and decide what number to press, all the irritations of dealing with a phone tree. So they get to us and we're able to assess whatever their issue is and get to the correct person, whether it's the provider, the clinic nurse, supportive care, the pharmacist, whoever it is that needs to address the issue. So we save some steps in care. I tell my patients that my main goal is to relieve stress and anxiety. And being available to the patient eliminates so much stress because so many times they don't know who to call. They don't know what they're really asking sometimes. And so that's where the navigator is really important.
What are the strategies or tools or resources that you have found success with helping improve access to care for those patients?
Well, it's still a work in progress. We have fantastic social services. I am constantly working with them, and our supportive care department is wonderful. I believe our patient that is being interviewed, he's a beautiful testament to that service. Unfortunately, HCC and the liver tumors don't have a lot of support in the community. We need to build more resources for the liver cancer patients.
What's your approach when you are working with this patient population?
First, I need to tell you, I am the most hopeful, optimistic person in the world. And I feel that there is hope for treatment going forward. Patients can experience pain. They can experience nausea, vomiting, all the GI symptoms, diarrhea, constipation. If we can manage pain, and that's tricky sometimes with these folks with substance abuse history. We oftentimes have to use our pain management specialists as well. And as we get benefit from the treatment and we get shrinkage of tumors, then those side effects do diminish. So that's always a goal and makes me hopeful. And I try to transfer that hope to the patients that life will get better if they'll just remain on treatment. Our goal is always quality of life. And I explain that to patients. It's what you deem as quality for your life, not what I think is quality for your life, but what's important to you. And how can we help you to be able to engage in those things and be able to partake of what brings joy to your life. So that's really our goals of care.
Thank you to our guests today. If you'd like to learn more about treatment guidelines for HCC, you can check out the show notes for resources and links. This episode was made possible with funding and support provided by AstraZeneca. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.